Circumcision is a practice that carries a rich and complex tapestry of meanings, woven through centuries of tradition, medical debate, and personal choice. To understand circumcision is to journey through the intersecting landscapes of culture, health, and identity, where each perspective offers its own insights and challenges. At its core, circumcision refers to the surgical removal of the foreskin, the tissue that covers the head of the penis. This procedure is one of the oldest known surgical practices, with evidence of its existence dating back thousands of years. Ancient civilizations such as the Egyptians, Jews, and various African tribes included circumcision in their rites and rituals, often imbuing it with profound spiritual and social significance. Culturally, circumcision has been a marker of religious identity and communal belonging. In Judaism, circumcision, known as Brit Milah, is performed on the 8th day of a boy's life, symbolizing a covenant between the individual and God. The ritual is deeply sacred, binding generations through a shared act of faith. For Muslims, circumcision is also customary, though its timing and meaning can vary. It is typically seen as an act of purification and adherence to the teachings of the Prophet Muhammad. In many African societies, circumcision is not only a religious rite, but also a passage into manhood, celebrated with elaborate ceremonies that reinforce community bonds and social hierarchies. Beyond these traditions, circumcision has been adopted in various forms throughout the world, sometimes divorced from its original cultural meanings. In the United States, for instance, circumcision became widespread during the late 19th and early 20th centuries, influenced by changing attitudes toward hygiene and health. The procedure was promoted as a way to reduce the risk of infections and diseases, and eventually became routine in many hospitals. Today, the rates of circumcision vary globally, reflecting a complex interplay of cultural norms, religious mandates, and shifting medical opinions. From a medical standpoint, circumcision is subject to ongoing debate. Proponents argue that it offers certain health benefits, such as a reduced risk of urinary tract infections in infancy, lower rates of sexually transmitted infections, including HIV, and decreased incidence of penile cancer. Some studies suggest that circumcised men may have a lower risk of acquiring certain infections, and that the procedure can make personal hygiene easier. These claims, however, are not universally accepted, and the magnitude of the benefits is often contested within the medical community. The World Health Organization and the Centers for Disease Control and Prevention have both issued cautious endorsements of circumcision, particularly in regions with high rates of HIV transmission. They emphasize that while circumcision can be part of a broader strategy for reducing infection rates, it is not a substitute for other protective measures, such as condom use and comprehensive sexual education. On the other hand, critics of routine circumcision raise important ethical and medical concerns. They point out that the procedure is not without risks. Complications can include pain, bleeding, infection, and in rare cases, more serious damage. The question of consent is also significant. Most circumcisions are performed on infants or young children who are unable to make an informed choice. Some opponents argue that unless medically necessary, circumcision should be postponed until the individual can decide for themselves. Moreover, there is ongoing discussion about the effects of circumcision on sexual sensation and function. While some research indicates minimal impact, others suggest that the removal of the foreskin may reduce sensitivity. These findings are still debated, and personal experiences vary widely. For many, circumcision is ultimately a personal decision, shaped by a constellation of factors. Parents may choose circumcision for their children out of religious conviction, cultural heritage, or perceived health benefits. Some adults elect to undergo the procedure later in life for medical reasons or personal preference. Others decide against it, valuing bodily autonomy or wishing to maintain their natural anatomy. In societies where circumcision is the norm, those who are not circumcised may feel social pressure or even stigma. Conversely, in places where circumcision is less common, those who undergo the procedure may be viewed as outsiders, These dynamics highlight the powerful role that social expectations play in shaping individual choices and identities. The conversation around circumcision also intersects with broader debates about bodily integrity, parental rights, and public health. Advocates for children's rights argue that non-medically necessary procedures should be deferred until the individual can participate in the decision. Medical organizations often recommend that parents be fully informed of the risks and benefits, emphasizing the importance of consent and transparency. As society evolves, so too do attitudes toward circumcision. In recent years, there has been a growing movement toward questioning routine infant circumcision, with more parents opting to delay or forego the procedure. At the same time, the practice remains deeply entrenched in many communities, sustained by tradition, faith, and long-standing beliefs about health and morality. Ultimately, circumcision is a deeply personal matter, best approached with empathy and respect for differing perspectives. For some, it is a cherished rite that connects them to their ancestors and spiritual heritage. For others, it is a medical choice, weighed carefully against the potential risks and benefits. Still others view it as an unnecessary intervention, preferring to preserve the natural body. Navigating these views requires open dialogue, accurate information, and a willingness to listen. Physicians, parents, and community leaders all play a role in shaping the conversation, ensuring that decisions are made thoughtfully and with respect for individual rights. The goal is not to prescribe a single answer, but to honor the diversity of experiences and values that surround this ancient practice. As we reflect on circumcision, its cultural, medical, and personal dimensions, we are reminded of the power of tradition, the complexities of health, and the enduring importance of choice. Whether one embraces or rejects the practice, the conversation itself is a testament to our shared humanity. Our desire to care for our children, uphold our beliefs, and make decisions that reflect our deepest values. In the end, circumcision is more than a surgical procedure. It is a window into the ways we navigate faith, science, and identity, balancing the wisdom of the past with the needs of the present. By embracing respectful dialogue and informed choice, we honor the rich tapestry of human experience that makes each perspective on circumcision unique.